Patient education is one of the most important roles for a nurse in any healthcare setting. Nurses provide patients with information needed for self-management of acute and chronic conditions, to ensure continuity of care from the hospital to the home. Patients have the right to know and be informed about their diagnoses, prognosis, and available treatments to help them make intelligent and informed decisions about their health and lifestyle. The goals of a well-designed, comprehensive teaching plan include providing a good fit with each patient's unique learning needs, reducing healthcare costs, improving quality of care, and ultimately changing behaviors to improve patient outcomes. Standards for patient education. All state nurse practice acts recognize that patient teaching falls within the scope of nursing practice. The Joint Commission standards mandate that nurses and the healthcare team assess the patient's learning needs and provide education. Ensure that your educational efforts are patient-centered by taking into consideration your patient's own education and experience, their desire to actively participate in the educational process, and their psychosocial, spiritual, and cultural values. It is important to document evidence of successful patient education in patients' medical records. Purpose of patient education. The goal of educating others about their health is to help individuals, families, or communities achieve optimal levels of health. Providing education about preventive health care helps reduce health care costs and hardships on individuals and those surrounding them. Patient education includes 1. Maintenance and promotion of health and illness prevention. Promoting healthy behavior through education allows patients to assume more responsibility for their own health. 2. Restoration of health. Patients recovering from and adapting to changes resulting from illness or injury often seek information about their conditions. The family often is a vital part of a patient's return to health. Family caregivers usually require as much education as the patient, including information on how to perform skills within the home. And 3. Coping with impaired functions. Not all patients fully recover from illness or injury. Teach family members to help the patient with healthcare management. Teaching and learning. Teaching consists of a conscious, deliberate set of actions that help individuals gain new knowledge, change attitudes, adopt new behaviors, or perform new skills. Learning is a process of both understanding and applying newly acquired concepts. Teaching and learning generally begin when a person identifies a need for knowing or acquiring an ability to do something. Teaching is most effective when it responds to the learner's needs. Role of the nurse in teaching and learning. Nurses have an ethical responsibility to teach patients. The nurse should determine what it is a patient needs to know and identify when they are most ready to learn. The Patient Care Partnership of the American Hospital Association indicates that patients have the right to make informed decisions regarding their care. The information required to make informed decisions must be accurate, complete, and relevant to patients' needs, language, and literacy. The Joint Commission Speak Up initiatives help patients understand their rights when receiving care. The Joint Commission Speak Up initiatives encourages the patient to speak up if you have questions or concerns, pay attention to the care you get, educate yourself about your illness, ask a trusted family member or friend to be your advocate, know which medicines you take and why, use a healthcare organization that has been carefully evaluated, and Participate in all decisions about your treatment. The assumption is that patients who ask questions and are aware of their rights have a greater chance of getting the care they need when they need it. The information required to make informed decisions must be accurate, complete, and relevant to patients' needs, language, and literacy. Patients are advised that they have a right to be informed about the care they will receive, obtain information about care in their preferred language, know the names of their caregivers, receive treatment for pain, receive an up-to-date list of current medications, and expect that they will be heard and treated with respect. Teach information that patients and their families need. Carefully determine what patients need to know and find the time to educate them when they are ready to learn. Please review Box 25(1), Evidence-Based Practice, the effectiveness of individualized patient education in self-management of diabetes, as a supplement to this PowerPoint. Teaching as communication. The steps of the teaching process are similar to the steps of the communication process. The nurse is the sender who conveys the message to the patient. The receiver in the teaching-learning process is the learner. Attitudes, values, emotions, cultural perspective, and knowledge influence the way information is delivered. The receiver in the teaching-learning process is the learner. The ability to learn depends on factors such as emotional and physical health, education, stage of development, and previous knowledge. Effective teachers can evaluate the success of the teaching plan and provide positive reinforcement. An effective educator provides a mechanism for evaluating the success of a teaching plan and then provides positive reinforcement. Feedback you receive from the learner is equally important because it indicates the effectiveness of instruction and whether or not you need to modify your approach. An example of a way to evaluate a teaching success is to have the patient demonstrate a skill or asking a patient to describe the dosage schedule for a particular medication. Learning occurs in 3 domains: cognitive, affective, and psychomotor. Cognitive learning requires thinking and encompasses the acquisition of knowledge and intellectual skills. The revised taxonomy of 6 cognitive behaviors is hierarchical and increases in complexity as in the following list. 1. Remembering. It involves learning new facts or information and being able to recall them. 2. Understanding. It is the ability to understand the meaning of learned material. 3. Applying. Applying uses abstract, newly learned ideas in an actual situation. 4. Analyzing. This refers to breaking down information into organized parts. 5. Evaluating. This is the ability to judge the value of something for a given purpose. And 6. Creating, which is the ability to apply knowledge and skills to create something new. Effective learning deals with expression of feelings and development of values, attitudes, and beliefs. Effective learning includes the following. 1. Receiving. The learner is passive and needs only to pay attention and receive information. 2. Responding. This requires active participation through listening and reacting verbally and nonverbally. 3. Valuing. It is attaching worth and value to the acquired knowledge as demonstrated by the learner's behavior. 4. Organizing. It is developing a value system by identifying and organizing values according to their worth. And 5. Characterizing, which involves acting and responding with a consistent value system. It requires introspection and self-examination of one's own values in relation to an ethical issue or particular experience. Psychomotor learning involves acquiring motor skills that require coordination and the integration of mental and physical movements. such as the ability to walk or use an eating utensil. Psychomotor learning includes the following: 1. Perception, which is being aware of objects or qualities through the use of sensory stimulation. 2. Set. It is the readiness to take a particular action. There are 3 sets: mental, physical, and emotional. 3. Guided response. It is described as the early stages of learning a particular skill under the guidance of an instructor that involves imitation and practice of a demonstrated act. 4. Mechanism. It is a higher level of behavior in which a person gains confidence and proficiency in performing a skill that is more complex or involves several more steps than a guided response. 5. Complex overt response. Smoothly and accurately performing a motor skill that requires complex movement patterns. 6. Adaptation. Motor skills are well developed and movements can be modified when unexpected problems occur. And 7. Origination. Using existing psychomotor skills to create new movement patterns and perform them as needed in response to a particular situation or problem. Please review Box 25-2, Appropriate Teaching Methods Based on Domains of Learning, as a supplement to this PowerPoint. Time for a quick quiz. A patient newly diagnosed with diabetes needs to learn how to use a glucometer. Use of a glucometer constitutes A. Effective learning, B. Cognitive learning, C. Motivational learning, or D. Psychomotor learning. The answer is D. Psychomotor learning involves acquiring motor skills that require coordination and the integration of mental and physical movements, such as using a glucometer. Basic learning principles. To teach effectively and efficiently, you must first be aware of the factors that influence how a person learns. A patient's learning style will affect his or her preferences for learning. People process information by seeing and hearing, reflecting and acting, reasoning logically and intuitively, and analyzing and visualizing. Motivation to learn is determined by the patient's attentional set, readiness to learn, and willingness to participate actively. Ability to learn depends on the patient's developmental level. Children will learn differently from adults. The physical environment makes learning difficult or a pleasure. The ideal environment must be well lit and must have good ventilation, appropriate furniture, and a proper temperature. Group teaching differs from one-on-one teaching. Motivation to learn. Before learning anything, patients must give attention to, or concentrate on, the information to be learned. Physical discomfort, anxiety, and environmental distractions influence the ability to focus. Determine a patient's level of comfort before beginning a teaching plan and ensure that the patient is able to focus on the information. As anxiety increases, a patient's ability to pay attention often decreases. Assess for and moderate the patient's anxiety. If a person does not want to learn, it is unlikely that learning will occur. You assess a patient's motivation to learn, and what the patient needs to know to promote compliance with his or her prescribed therapy. No therapy has an effect unless a person believes that health is important and that the therapy will improve health. Using a theory that matches a patient's needs and personal learning preferences allows the patient to become an active participant, leading to effective instruction. Social learning theory considers the personal characteristics of the learner, behavior patterns, and the environment, and guides the educator in developing effective teaching interventions that result in improved motivation and enhanced learning. Self-efficacy, a concept included in social learning theory, refers to a person's perceived ability to successfully complete a task. Self-efficacy beliefs come from four sources: enactive mastery experiences, vicarious experiences, verbal persuasion, and physiological and affective states. Self-efficacy is a concept included in many health promotion theories, because it often is a strong predictor of healthy behaviors and because many interventions improve self-efficacy, resulting in improved lifestyle choices. Patients need to grieve, and the process of grieving gives them time to adapt psychologically to the emotional and physical implications of their illnesses. Patients will go through stages of grieving at different rates. Readiness to learn is related to the stage of grieving. Patients cannot learn when they are unwilling or unable to accept the reality of illness. Please review Table 25.1, Relationship between psychosocial adaptation to illness, grief, and learning, as a supplement to this PowerPoint. Ability to learn. Cognitive development influences the patient's ability to learn. You need to know the patient's level of knowledge and intellectual skills before beginning a teaching plan. Learning occurs more readily when new information complements existing knowledge. For example, measuring liquid or solid food portions requires the ability to perform some mathematical calculations. The developmental stage of a child determines the capability and types of behaviors that children are able to learn. Without proper physiological, motor, language, and social development, many types of learning cannot take place. Please review Box 25.3, Teaching Methods Based on Patients' Developmental Capacity, as a supplement to this PowerPoint. Teaching adults differs from teaching children. Adults are able to critically reflect on their current situation, and sometimes need help to see their problems and change their perspectives. Adults tend to be self-directed learners, but they often become dependent in new learning situations. Make education patient-centered by developing educational topics and goals in collaboration with the adult patient. Assessing what an adult patient currently knows, teaching what the patient wants to know, and setting mutual goals improve the outcomes of patient education. The ability to learn often depends on the patient's level of physical development and overall physical health. To learn psychomotor skills, a patient needs to possess a certain level of strength, coordination, and sensory acuity. Any condition, such as pain or fatigue, which depletes a person's energy, also impairs the ability to learn. As you work with a patient, assess energy level by noting the patient's willingness to communicate, the amount of activity initiated, and responses to questions. A good learning environment is well lit, has good ventilation, appropriate furniture, is a comfortable temperature, and is quiet and private. The number of people included in the teaching session is also an important factor. The ideal setting helps the patient focus on the learning task. Teaching a group of patients requires a room that allows everyone to be seated comfortably and within hearing distance of the educator. Make sure that the size of the room does not overwhelm the group. Arranging the group to allow participants to observe one another further enhances learning. More effective communication occurs as learners observe others' verbal and nonverbal interactions. During the assessment phase of the nursing process, determine a patient's healthcare needs. When education becomes a part of the care plan, the teaching process begins. Develop specific learning objectives, implement appropriate patient-centered teaching strategies, and use learning principles to ensure that your patient acquires the necessary knowledge and skills. Finally, the teaching process requires an evaluation of learning based on learning objectives. When providing patient education, it is important to partner with the patient to ensure safe, compassionate, and coordinated care. To be successful in teaching a patient, you need to assess all factors influencing the choice of relevant content: the patient's learning needs, motivation to learn, and ability to learn, the teaching environment, the resources available, and any health literacy and learning disabilities. Learning needs, identified by both you and the patient, determine the choice of teaching content. An effective assessment provides the basis for individualized patient teaching. To meet these learning needs, assess what patients view as important information to know. This assessment should include the following: information or skills needed by a patient to perform self-care and to understand the implications of a health problem, patient experiences, such as a new or recurring problem and past hospitalization that can influence the need to learn, and information that family caregivers require to support the patient's needs. Please review Table 25-2, Comparison of the Nursing and Teaching Processes, and Box 25-4, Nursing Assessment Questions, as a supplement to this PowerPoint. In order to accurately care for the patient, the nurse should perform a thorough patient assessment of the following: the patient's motivational factors, their ability to learn, environmental factors, and resources within the home. The nurse should assess the following motivational factors: 1. Behavior, 2. Health beliefs and socio-cultural background, 3. Perception of the severity and susceptibility of a health problem, and the benefits and barriers to treatment, 4. Perceived ability to perform needed health behaviors, 5. The patient's desire to learn, 6. Attitudes about healthcare providers, and 7. Learning style preference. The following factors related to the patient's ability to learn should be assessed: 1. Physical strength, endurance, movement, dexterity, and coordination. 2. Sensory deficits that affect a patient's ability to understand or follow instruction. 3. Patient's reading level. 4. Patient's developmental level. 5. Patient's cognitive function, including memory, knowledge, association, and judgment, and 6. Pain, fatigue, depression, anxiety, or other physical or psychological symptoms that interfere with the ability to maintain attention and participate. Environmental factors that should be assessed include distractions or persistent noise, comfort of the room, including ventilation, temperature, lighting, furniture, and size, and finally, room facilities and available equipment. The nurse should also assess resources within the home environment. These include: 1. Patient's willingness to have family caregivers involved in the teaching plan and provide health care. 2. Family caregivers' perceptions and understanding of a patient's illness and its implications. 3. Family caregivers' willingness and ability to participate in care. 4. Resources, including financial or material resources, such as having the ability to obtain health care equipment. And 5. Teaching tools, including brochures, audiovisual materials, or posters. Case study: Latinka Drusko is a 55-year-old Bosnian immigrant. She is overweight and is concerned about her health. She has come in for her yearly physical. Ashley is a 23-year-old nursing student assigned to care for Latinka. During their first visit, Latinka states, "I am interested in getting some information to help me become healthier and lose some weight." What are some of the obstacles that Ashley may encounter when providing patient education? The elderly, minorities, immigrants, persons of low income, and people with chronic mental and/or physical health conditions are at greatest risk for low health literacy. Approximately half of Medicare and Medicaid recipients are functionally illiterate. Functional illiteracy is the inability to read above a 5th grade level. The reading level of healthcare materials ranges from elementary school level to college level. Patients with low health literacy may not be able to understand a basic patient education pamphlet, or to determine interactions on a medication label. Patients with low math skills will have difficulty calculating medication dosages and frequencies. Because health literacy influences how you deliver teaching strategies, it is critical for you to assess a patient's health literacy before providing instruction. In addition to illiteracy, assess patients for learning disabilities. To assess health literacy, ask patients to perform simple literacy skills. The Wide Range Achievement Test is a word recognition screening test that evaluates reading, spelling, and arithmetic skills for patients from 5 to 74 years of age. The Rapid Estimate of Adult Literacy in Medicine uses pronunciation of healthcare terms to determine a patient's ability to read medical vocabulary. The Closed Test, used to assess comprehension of health education materials, asks patients to fill in the blanks that are in a written paragraph. After the assessment is completed, select the nursing diagnosis that best reflects the patient's learning needs. Some relevant nursing diagnoses may include deficient knowledge, ineffective health maintenance, impaired home maintenance, ineffective family therapeutic regimen management, ineffective self-health management, non-compliance. Please review Box 25.5, Nursing Diagnostic Process, as a supplement to this PowerPoint. Planning. After determining the nursing diagnoses that identify a patient's learning needs, develop a teaching plan, determine goals and expected outcomes, and involve the patient in selecting learning experiences. The more specific the plan, the easier it is for nurses to follow. Include the patient when determining priorities for patient education. Plan teaching activities for a time when the patient is most attentive, receptive, and alert, and organize the patient's activities to provide time for rest and teaching learning interactions. Although prolonged sessions cause concentration and attentiveness to decrease, make sure that teaching sessions are not too brief. Begin instruction with essential content because patients are more likely to remember information that you teach early in the teaching session. A concise summary of key topics helps the learner remember the most important information. Although the nurse is the member of the healthcare team primarily responsible for ensuring that all patients are educated, sometimes patient needs are highly complex. In these cases, identify appropriate health education resources within the healthcare system or the community during planning. Nurses use learning objectives to set learning priorities. Please review the nursing care plan on page 347 for an example of a care plan that addresses deficient knowledge before a surgical procedure. Implementation depends on the nurse's ability to critically analyze assessment data when identifying learning needs and developing the teaching plan. Use evidence-based interventions to create an effective learning environment. Active participation is key to learning. Persons learn better when more than one of the senses is stimulated. When conducting a discussion with a learner, an educator stays active by changing the tone and intensity of his or her voice, making eye contact, and using gestures that accentuate key points of discussion. A teacher is more effective when presenting information that builds on a learner's existing knowledge. A patient quickly loses interest if a nurse begins with familiar information. Teaching approaches include telling, participating, entrusting, and reinforcement. A combination of teaching methods improves the learner's attentiveness and involvement. In the participating approach, a nurse and patient set objectives and become involved in the learning process together. The entrusting approach provides a patient the opportunity to manage self-care. The patient accepts responsibilities and performs tasks correctly and consistently. A learner who receives reinforcement before or after a desired learning behavior is likely to repeat the behavior. Effective teachers use positive reinforcement. Many nurses find that they are able to teach more effectively while delivering nursing care. Teaching during routine care is efficient and cost-effective. Choose instructional methods that match a patient's learning needs, the time available for teaching, the setting, the resources available, and your comfort level with teaching. Groups are an economical way to teach a number of patients at one time, and patients are able to interact with one another and learn from the experiences of others. Learning in a group of 6 or fewer is most effective and avoids distracting behaviors. Preparatory instruction consists of providing information about procedures before they occur. It often decreases anxiety because patients have a better idea of what to expect during the procedure. Use the following guidelines for giving preparatory explanations. 1. Describe physical sensations during a procedure. 2. Describe the cause of the sensation, preventing misinterpretation of the experience. 3. Prepare patients only for aspects of the experience that others have commonly noticed. And 4. Be sure the patients know when the results will be available and who will give them the results of their tests and/or procedures. These demonstrations are most effective when learners first observe the teacher and then, during a return demonstration, have the chance to practice the skill. An effective demonstration requires advanced planning. Be sure that the learner can see each step of the demonstration easily. Assemble and organize the equipment. Perform each step slowly and accurately in sequence while analyzing the knowledge and skills involved and allow the patient to handle the equipment. Review the rationale and steps of the procedure. Encourage the patient to ask questions so he or she understands each step. Judge proper speed and timing of the demonstration on the basis of the patient's cognitive abilities and anxiety level. To demonstrate mastery of the skill, have the patient perform a return demonstration under the same conditions that will be experienced at home or in the place where the skill is to be performed. Analogies supplement verbal instruction with familiar images that make complex information more real and understandable. Follow these general principles when using analogies. 1. Be familiar with the concept. 2. Know the patient's background, experience, and culture. And 3. Keep the analogy simple and clear. Simulation is a useful technique for teaching problem solving. Application. and independent thinking. During individual or group discussion, you pose a pertinent problem or situation for patients to solve. Using strategies to promote health literacy creates a more patient-centered approach to health education and can have a significant impact on patient outcomes. You can promote health literacy by creating a safe, shame-free environment, using clear and purposeful communication techniques, using visual aids to reinforce spoken material, and taking special care to evaluate patient understanding of the content. For patients with vision problems, do not shout, as they have acute hearing. You should appreciate the patient's cultural background and belief system and gauge his or her ability to understand instructions in the language that may be different from his or her native language. Be careful not to generalize or stereotype patients solely on the basis of their culture. Also, be aware of intergenerational conflicts of values. Many teaching tools are available for patient education. Examples include pamphlets, booklets, brochures, computer programs, diagrams, charts, pictures, audiovisual materials, and physical models. It is important to incorporate parental input in planning health education for children. Older adults learn and remember effectively if you pace the learning properly and if the material is relevant. Time for a quick quiz. During a teaching session, the nurse tells a patient with a recent neck injury that damage to the nerves is comparable to a water hose that has been pinched off. During this teaching session, the nurse is using the process of A. Analogy, B. Discovery, C. Role-playing, or D. Demonstration. The answer is A. Analogy. An analogy is used to compare a situation with another situation that may be familiar to the patient to help with understanding. Before she meets with Latinka again, Ashley decides to read about the Bosnian culture. Among other things, she learns that Bosnians tend to have strong ties with their families and communities. When they speak again, Ashley asks about Latinka's community and learns that she is very close to her children and neighbors. How can Ashley tailor her plan for Latinka based on this information? Many times, people who are successful at sticking to an exercise plan often exercise with other people. Ashley should help Latinka develop an exercise routine that includes her children and friends. Patient education is not complete until you evaluate outcomes of the teaching-learning process. Engage patients in the evaluation process to determine if they have learned essential material. It is also important to determine if patients believe that they have the information necessary to continue self-care activities within the home. The nurse is legally responsible for providing accurate, timely patient information that promotes continuity of care. Therefore, it is essential to document the outcomes of teaching. Documentation of patient teaching also supports quality improvement efforts, meets the Joint Commission standards, and promotes third-party reimbursement. You evaluate success by observing a patient's performance of each expected behavior. The ability of the patient to recall and comprehend information that has been taught is a predictor of patient adherence to health and disease management. Teach back is a closed-loop communication technique that assesses patient retention of the information imparted during a teaching session. If the patient has difficulty recalling the material or demonstrating a skill, modify and repeat the content and reassess his or her retention.